Assalamu alaikum friends and welcome to my YouTube channel. I am Sikandar Kori. So let's start our topic. Today in this video we are going to talk about disease of thyroid gland, which are most common among the disease of all endocrine glands. First of all, we are going to talk about hypothyroidism, where the word hypo means below the normal. So this condition is characterized by low level of thyroid hormone, mainly T3 and T4 in the blood. In most of the cases, this condition arises due to two causes. First one is low iodine consumption in the diet, and second one is loss of the functional thyroid tissue. In case of iodine deficiency, thyroid gland cannot synthesize enough thyroid hormones T3 and T4. That's why we see low level of thyroid hormone in the blood. This will affect negatively to the hypothalamus, which will release high level of thyroid releasing hormone in the portal circulation, which will trigger the anterior lobe of the pituitary gland to synthesize and secrete high level of thyroid stimulating hormone in the blood. So in this condition, we see high level of thyroid releasing hormone and thyroid stimulating hormone in the blood of patient. So due to the overstimulation of the thyroid gland by the thyroid stimulating hormone, it will eventually result in the enlargement of the thyroid tissue, or we can say hypertrophy of the thyroid gland, which will result in goiter development. The second cause of this condition is the loss of functional thyroid tissue, which is due to the destruction of the thyroid gland by cytotoxic cells of our immune system. And this disease is known as Hashimoto's disease. Like all other autoimmune diseases, this disease is also more common in females, and goiter can also develop in this condition. Whatever the cause is, every patient with hypothyroidism shows similar symptoms such as fatigue, such as extreme sleepiness or somnolence, the other word for sleepiness, sluggish, dry and scaliness of the skin, very sensitive to cold, overweight, mental retardation, frog-like husky voice, loss of the hairs, and slowed heart rate. So these are all the symptoms of hypothyroidism. And if this hypothyroidism condition occur very early in age, such as in fetal life or right after birth in infant life, this will result in keratitism, which will affect the development and growth of the baby, which will show the symptoms of mental retardation and stunt growth. And in most severe cases of the hypothyroidism in elder persons, this will result in myxedema, which is caused by almost total lack of thyroid hormone function. Myxedema, which is characterized by puffiness of the skin and swelling of the face. And now we are going to talk about hyperthyroidism. The other term for this condition is thyrotoxicosis, and this condition is characterized by high level of thyroid hormone in the blood. This condition also caused by two main causes. First cause is autoimmune disease in most of the cases, and second cause is hormone secreting tumor cells, which is rare. Autoimmune disease which result in hyperthyroidism is Graves' disease, which is also more common in women, and in this condition antibodies are produced in the blood which will recognize the thyroid stimulating hormone protein of the thyroid gland. Protein receptor in this case is not destroyed but are stimulated in a manner similar to the thyroid stimulating hormone to synthesize and secrete thyroid hormone in the blood. So in this condition there is no thyroid stimulating hormone in the blood, but yet these antibodies stimulate the gland to produce thyroid hormones. And due to the overstimulation, water can also develop in this condition. The second cause, hormone secreting tumor cells in rare cases, and this condition is known as thyroid adenoma, and in which the tumor cells will start secreting thyroid hormone in the blood on its own. So the negative feedback system will have no effect on those tumor cells. The symptoms of hyperthyroidism are extreme fatigue and muscle weakness, inability to sleep, increased sweating, intolerance to the heat, very sensitive to heat, rising temperature, increased heart rate due to the increase in sympathetic activity, weight loss, tremor of the head, exophthalmia, which is defined by the protrusion of the eyeballs in hyperthyroidism individual. Thank you for watching our video, and please like, share and subscribe to our channel.